Farwa is 5 years old and her cousin Mehdi is 7. They were both patients of a private doctor who in 2019 was accused of transmitting AIDS to thousands of children by reusing disposable syringes.
When he was 7 months old, he fell ill. He had diarrhea that wouldn't stop. We took him to the doctor to put him on an IV. After that, he started to have rashes all over his body. They took him for tests and they discovered he had AIDS. And she was born with a deformity. She had to be operated on 3 times. She started having a fever that wouldn't go down. She was taken for tests and she tested positive for HIV.
In the small town, the children's diagnosis sent a shock wave of fear. People living with HIV are stigmatized and discriminated against in Pakistan. These children are now treated like outcasts.
When they go outside to play, mothers get angry and tell us that we should not let our children play with others because of their illness. When we go to family celebrations, religious celebrations and gatherings, people look at us with hatred. They say, why are they coming? They are sick. Our children are still young, but we are worried about their future. And we wonder if anyone will agree to marry them later, despite AIDS.
The family lives in poverty. The income of Zakia's farm worker husband does not allow them to afford an air conditioner or a refrigerator. The temperature regularly goes over 40 degrees.
They take this medicine in the morning and this one in the evening. We should normally keep them in a cool place, but we have no choice but to leave them here.
Until last year, the number of children diagnosed with HIV in Ratodero was estimated at more than 2,000. This is Pakistan's biggest healthcare scandal. In the neighboring village, 35 children are infected with the virus. Families are desperate.
He has lung problems as well as HIV and needs treatment at a private clinic. He often has a fever. We can't pay for medicines other than HIV treatment because we don't have a regular salary.
We use 1/3 of our income to meet our needs. The rest is spent on his medical care. As he is weak, he falls ill at least 2 or 3 times a week. Every time we take him to a private doctor, the doctor's fees and medicines cost a total of 3,000 rupees, the equivalent of 10 euros.
Since rural population is among the most vulnerable in Pakistan, it has also one of the highest illiteracy rates in the country. Clinics run by private doctors look like cramped shops. With little to no hygiene measures, the patients wait for their turn in the greatest proximity. However, the authorities have cracked down on doctors engaged in illegal and dangerous medical practices in the wake of HIV outbreak. Nearly 3,000 clinics have been closed down. This general practitioner has been working in the region since 1992. He treats adults, children and infants like this baby who has been sick for several days.
This is a case of thalassemia, and he also has breathing problems. If they find a donor, we can do the blood transfusion here. Otherwise, we will have to send them to the district hospital. We will check if the compatibility with the potential donor is good, and then we will do the transfusion here. Yes, here.
The doctor, however, refuses to show us the syringes he uses and even discreetly orders his assistant to go and remove all patients' IVs in the next room. Dr. Mangi was not implicated in the 2019 HIV scandal. He claims to follow hygiene standards, but according to him, mentalities must also change.
In rural areas, there are poor medical practices. Fake doctors or quacks use disposable syringes numerous times on several different patients. And patients believe that if they take the drug by injection, they will get better quickly. They even ask us for multiple injections, 2 or 3 at the same time. This trend has existed for 10 to 15 years and continues to grow.
This HIV testing and treatment center was created 5 years ago to tame the AIDS epidemic in the district. Here, the treatment is fully paid by the government. Everyone can get tested for free. This little girl is getting tested. She often falls ill.
We brought our daughter here to check if she is positive or not because my wife has HIV. We have 3 older children. We hope she is not HIV positive. We are scared. My wife has been ill for a year. She is weak and cannot do anything at home.
Despite the absence of a district-wide screening program, thousands of adults and children have been tested over the past 5 years. Every week, nearly 3 new cases are discovered in this center, an underestimated figure according to Dr. Shahida Hafiz.
Ratodero is a small town with several villages on the outskirts. The rural population is not well educated and poverty is a major problem. They therefore avoid getting tested because they're afraid of being positive and having to come back here regularly to obtain medication.
Since 2019, more than 200 children have officially died from AIDS in the Larkana district, as the virus continues to spread among the most vulnerable in the society.